of the infections of fungal and bacterial infections involves the superficial layers, and some of the infections that goes to deep. So most of the fungal infection what we are getting in our OPDs are 90% is superficial infections of the skin. Okay. So the natural defense system of the skin, that is the temperature less than 37 degree. So our skin will be protected if the temperature level is less than 37, and also if more than more than 37, so maybe more exposure to sunlight extra, always that distracts our the skin health and dryness. You should always hydrate your skin. You have to drink more water, but externally you have to keep your skin dry, because all the infections of the skin which affects on the wet areas of the skin. The skin, especially in the skin folds, on the armpits and the groin. With the infections of the fungal infection, most of the patients, they are coming with the itching and the superficial lesions, maybe below the breast and on the armpits, maybe on the groin, on the cleft areas. So you should always tell your patient that externally, always keep the skin dry. Okay. And the keratin. Keratin is a protective layer that the outermost layer that also keeps your skin healthy. And skin sloughing means the dead cell that rupture, no, or each skin cell completely rupture by 24 to 27 days. After that, the skin start to peel off. That process is called skin sloughing. That also help to help the skin from some of the bacterial or fungal infections. And sebum, the sebum, it has low pH and high lipid content. Also protect the skin. It hydrates your skin. And sweat also lowers the pH, high salt content, and lysosine. That one also help to keep the resident flora healthy. Okay. And keeps away from the action of the toxic lipids. And skin-associated lymphoid tissue, that is the defense mechanism of the skin, that represents the immune cells of your skin. And whenever we have some deep infection, some of the associated lymph nodes may enlarge, and it starts to defense your skin. And resident microflora, mostly the gram-positive microfloras. The normal skin floras, that's propionic bacterium acnes. This causes acne in your skin. Corynebacterium species, Staphylococcus epidermis, and Staphylococcus aureus. Most of the impendigo cases caused by these bacteria. Streptococcal species, Candida albicans, some yeast infections, and some many other resident floras are there. Route of infection, mainly through the skin, from the pores and hair follicles. And secondary infection may through the wounds, scratches, or cuts or burns, or maybe from the bites, insect bites, or from the animal bites. Primary infections always caused by a single pathogens, usually affects the normal skin. From that, it spreads to another stage. Those examples are impetigo, that's folliculitis, the hair follicle infections, and boils. Maybe a single part or a single point is affected. After that, it spreads to another points. And the secondary infections always okay. And in the case of secondary infections, the skin is already diseased one. And through that, the microorganisms are enter your skin, and it may cause some disease. From that, it may enter to the blood vessels, and it may cause some systemic illness. The same way, the primary infections which enters the body and affects the nerve tissues and causes some neuropathic like infections like a herpes zoster. Okay, that's a viral infection. Okay. So primary always through a normal skin, secondary through a damaged skin. This is the example from the primary infections like this Staphylococcus aureus, corniforms, dermatophytes, etc. That attacks the normal skin, and another one secondary through the damaged skin and causes some systemic illness also. These are the infections and causative organisms. Impetigo, Staphylococcus aureus, and cellulitis, group A streptococci, folliculitis, that's Staphylococcus aureus, and all things. Okay. And also this damage from the these may enter in the body and causes some toxicity. These circulating toxins may cause scarlet fever, toxic shock syndrome, etc. And the skin lesions, those who are prone to allergic sensitivity, hypersensitivity reactions towards the microorganisms can cause erythema nodosum and vasculitis. And skin disease always provoked by the attack of a microorganism, psoriasis. So a person, if, simply any infections can trigger psoriasis. That's why in the COVID time, the patient who are affected with the psoriatic patients who are affected with COVID scan after when they have this symptom, when the COVID become negative, the psoriasis lesion may increase. So the psoriasis is an infection which provoked by any of the infections in the body. And Staphylococcus aureus infections that impetigo, echyma, folliculitis, fungallosis, carbuncle, and psychosis barbae. And cutaneous infections that through the bacterial toxicities are staphylococcal scalded skin syndrome, SSSS. That's and we should go for this like antibiotic treatments and all, toxic shock syndrome. And the infections caused by the hemolytic streptococci, that direct infections, that's impetigo, echyma, erysipelas, cellulitis, and necrotizing fasciitis. Necrotizing fasciitis also complete purely. It's we should if it is a say how this it is coming to us. Its necrosis is continuously happening for the fascia. So high antibiotics is needed, or other things the first stage we can manage. Cellulitis also, if the patient is coming in the secondary stage, we should refer for a antibiotic treatment. Otherwise, it cannot be controlled with our medicines. Okay. So secondary infections, eczema also, hemolytic streptococci. And the first one is impetigo. That is initially it starts as a vesicle infection. Then to pustules, the vesicle turn to pus-filled structure. Then it will break and this discharge form a honey-colored crust. That is the significant feature or the differential diagnosis of impetigo. When the discharge is just like the color of a honey and it forms a crust-like formation, that's honeycomb-like lesions, it shows the impetigo, okay, which having an erythromatic base. Echyma, which is pustule, begin as a vesicle that rupture and causes the erythematous lesions with adherent crust. But here we couldn't see the honey-like crusts. Okay. Folliculitis, that is an infection of a hair follicles, and it causes also small red papules and pustules surrounding the individual hairs. That's a folliculitis. Fungal, it's a deep-seated inflammatory nodule with a pustular center around a single hair follicle, that is fungal. It will be painful, localized abscess. As a single one boil, it's happening in the body. The patient may come to OPD with a single boil. When we are examining, we can see that a single in the center, a small pustule you can see. In the case of a carbuncle, the same feature, but more than one, there 2 or 3 or 4 follicle that's follicular orifices. Cutaneous abscesses, that's painful, fluctuant. Doctor is audible. Tender swelling you can see. And erysipelas, it's an erythema swelling in the cutaneous surface. It's a blister forming like you can see. Cellulitis, you know, it will be red in color, while touch it is warm. And without a proper, no border you can see, it's a, it's spreading like a, that erythema. Okay. With irregular edge, that's the importance of cellulitis. Same lesion with a regular margin with the blisters in the erysipelas, you can see. Okay, I'll show the pictures. Acne, you know, infection of the sebaceous follicles, and which that's orifices which is blocked by the keratin tissue. And when it is closed, first one, the pores are closed, it will be white in color, whiteheads. If it is opened and oxidizing with the atmosphere, black, there's a blackheads. And in that area, the infections, bacterial growth is there and causes acne. Okay. And necrotizing fasciitis, it's a rapid spreading cellulitis with a necrosis. In my OPD, I have seen one case, but I referred because it's a just whole fascia is infected and he comes as a blister, and that's just like oozing. And when I asked him the history, he told he was a farmer. When he was working with his field, something has some bites has he's like this says like that some bite has happened, and first he didn't notice that. After that, it just started to spread the whole areas. I don't know whether maybe through that cut wound the bacteria infection may happen. Maybe as a secondary infection, he caused that, and one case. And we are going to the each cases, that impetigo and impetigo is a superficial skin infection with the crusting, as I told. It's two types, non-bullous and bullous type, caused by the streptococcus, staphylococcus, or both bacteria. And it's ulcerative form. When it is break and causes an ulcer, it is called ecchyma. Okay. And if a patient is coming with such lesions, mostly maybe on the antecubital fossa, maybe misdiagnosed with the atopic dermatitis, because in this area, maybe a chance of atopic dermatitis. We know in the cubital fossa and the flexural areas, in both these areas, maybe if the lesions are here, the chance of atopic dermatitis. The same lesions you can see here, it may chance of a psoriasis. So if a patient is coming with such a lesion with a honeycomb clusters, it may be that impetigo infections, and take the history thoroughly and go for the treatment. Children's, these infections are mainly on the summer times. Non-bullous impetigo and bullous impetigo. And I said non-bullous, always mixed infections, both staphylo and streptococcal bacteria you can see. And here, non-bullous, so thin wall vesicles on the erythematous base. It may rupture, and the exudic serum, it's like yellowish color and forms like a crusty formation you can see. Okay. See, like these features you can see with the mostly affected on the babies. See, like this. Sides, mostly on the face, extremities, except palms and soles. Okay. And maybe complications, post-staphylococcus acute glomerulonephritis. If the patient is severely affected, you should thoroughly examine that and ask for the urine output and check for the pedal edema. If any of this is that's indicating, you just refer the case. Okay. And varieties, succinate impetigo. Here, maybe we may confused maybe with the fungal infections, cutaneous fungal infections, tinea infections. So what's the difference here will be healing from the center and the peripheral. The same thing we can see in the fungal infection, but here the exudation you should check. No exudation you can see on the fungal infections, but the honey-like exudations and crusty formation you can see in this impetigo. Okay. And crusted impetigo on the scalp, also you can see in the occipital area and both cervical lymph node, maybe bulging. And also you should check because the fungal infection of the scalp always will be there, and check out for the exudation and go for the treatment. Same thing, then a patient is coming to you with a seborrheic dermatitis, you may confused. There also no exudation, but when you are scraping the area, you can see a greasy like substance in your hand. And if you are observing only the lesions, no exudation, maybe fungal infections. Okay. Here, the better thing, if you can go with the Aragodadi Kashayam Shalanam, Shirodhara or Shiro Shalanam also you can do with Aragodadi, or Tribala Kashayam is also beneficial, and better to avoid any oil on the scalp area if affected with the on the scalp. Okay. And erythema, it's ulcerative impetigo. It might be the same as we are seeing as a impetigo, but the ulceration will be deep. Okay. It takes much weeks than impetigo to heal. It may cause some scarring also. Mostly on the dorsal extremities, thighs and legs. Bullous impetigo, just like bullous you can see. All any of the ages you can see. Any areas. In that impetigo, like non-bullous, may not be forms on the palms and soles, but bullous anywhere in the body can happen. This bulle, it may take 2 to 3 days to completely filled up, and sometimes it won't break. Okay, and it spreads to another size, just like bulles you can see. If it is highly infected, and you can refer, and also pediculosis, lice infections of the skin on the head, and also body lice or head lice and scabies can trigger its fast spreading. And you can use, you have to remove the crust by, if oil, only no exudation. Otherwise, do only the kshalana. Okay. And the treatment we have to give for such a patient is Pitta Raktahara. Like Visarpa line of treatment we have to adopt. Vispora line of treatment you have to adopt here. Anything, any disease which has a Sarpana Swabhava, we should call it as a Parisarpa or Visarpa. Na Pitta Rakta Vina Visarpastu. So in the case of Visarpa, there should be the involvement of Pitta and Rakta. So whenever we are treating a case which having the spreading nature, fast spreading nature, which have the involvement of Pitta and Rakta, we can consider under this Visarpa. So here the main treatment we have to focus on Pitta and Rakta. So any infections, any staphylococcal or streptococcal, we can very good, we can manage by Gobi Chantanadi Gulika and Sudarshanam Gulika. Okay. And Vilvadi Gulika, as always, in all kind of infections we are using. And Tribalak Shalanam. In any of the skin disease, you don't start with oil application or any ointment application, just do the kshalana. If there is that oozing, you take Tribhala, because it has the Hara property. So you can use that. Aragudadi Ganam Kashayam, we can use that because it is told in the case of Dushtavrana. You can use that for cleansing the exudation, cleansing the wound, to remove the kleda from the wound. Okay. And Nili Tulasyadi Kashayam. Nili Tulasyadi Kashayam, actually it is told in the case of Ludavisham. Ludavisha Prakarana, Ludavisha is a Pitta Rakta, predominant. So any treatment we are telling it Ludavisha Prakarana, you can use here also. Okay. And Nirgundiyadi Kashayam is told in the case of Krimi Prakarana. So any microbial organisms, any infections, it's we are considering under Krimi Chikitsa, and you can continue with the Nirgundiyadi. Okay. And Guluchadi, Pitta, Kleda, Pitta Kapahara property. So you can use Guluchadi Kashayam, Avipatti Churnam, to remove the excess Pitta from the body for a Virechanam. Nitya Virechanam you can use, and Avipatti Churnam. If the bulle that forms and it is not at all breaking by itself, the thing you can use, take the anna, because the cooked rice, and make a paste and apply over the bullets and do a bandage. After 1 hour or after 2 to 3 hours, the bulle will break easily. After that, you can go for the Vranahara line of treatment. Okay. Yes. That's a fluid-filled vesicles, like big bullets. If we are there, if it is not breaking, this is a very good lepana poultice form you can apply. And Padoladi Kashayam. Padolagadi Ganam Kashayam is there, Pitta Kabharam. And this is another yoga. Padola, Yeva, Thaniga, Mudga, Amalaka Chandanam, Paitige, Sleshma Vadotere, Jvare, Trichardi Dahanu. This Padoladi Kashayam is very effective in the case management of the fast spreading bulle formations in the impetigus. Padola, Eva, Thaniga, Mudga, Amalaka Chandanam. The importance of this kashayam is having Yeva and Mudga. So the patient is as a porridge, as a soup you can give for your patient. Okay. And if the patient in this, in these conditions, we are restricting the food, only vegetarian food, reduce the amla, lavana, kadu. And in such cases, you can give as a soup also. And Jivandyadi Kashayam, which is explained in Masurika Prakarana, it's available for the markets. I think by 4 Kottakkal it is there. It's also very good to control the Pidaka formations. If the patient is Balavan and it is Bahudosha, so you can go with Padola Muladi Kashayam Videshanam. Padola Muladi is a Tikshna Videshana, Ruksha Videshana drug. And if we are giving, actually we are giving for 6 days. And the whole 6 days, the patient is completely under Rajana. So you have to tell the patient that's the morning and the whole food is only the rice gruel added with the Mudga Yusha. Because actually for the Padola Muladi Kashayam, Mamsarasa is telling us Anupana. But in the case of skin disease, we couldn't administer Mamsarasa because as it is a Ruksha Virejana, it may increase Vata in the body. So the only lentils we can give, this is Mudga only. So Mudga is Snigdham Alpa Vadaharam. So you can use that to remove the excess vada in the body. So as a soup or as a curry or anything, they can use this mudga. And the kashaya, powder sukshma churna is more beneficial than coarse powder. And no virejana happens with the bottle kashayam or with tablet. So better you can tell the patient to take sukshma churna and take 10 grams of powder. And they can put it in 300 ml of water, reduced to 100 ml in the morning, 100 ml in the evening, morning in the empty stomach, evening at bedtime, added with the Kaishora Guguru, they can give. And the patient, they have to take the dinner before 7:30, and they can take the Kashaya by 10:30. So at morning, the patient start to Rejana. After complete Rejana, they can start with this rice gruel. Okay. And Guluchya Kashayam. And also, before you are giving, administrating Padola Muladi Kashayam, you tell your, counsel your patient or teach your patient that there should be abdominal pain, there should be nausea, there should be some sort of screw-like pain in the abdomen. All this because of the Padola Muladi Kashayam only. Okay, otherwise the patient may call in the morning, doctor, I have some abdominal discomfort. I feel some pain like that. So always it is associated with the Padola Muladi, the pain should be there. So while giving only, you tell the patient. Okay. And also ask the patient to call in the morning and ask them how many times they had gone. If with the 10 grams of powder, only 2 or 3 Rejanas happen, you can increase the dose. Okay. Then Guluchya Kashayam, they can use. Nimba Nilavagati Kashayam. It is this Kashaya is told in the Ayurveda Pharmacopoeia of India. And it is as a follow-up dose for a continuous usage because it contains chandana and all. So it's acting as a rasayana also. Triphala Gugulu you can add. Another Kashaya Yoga, you can give that Skulagadi Kashayam. It's also told in the Visarpa Prakarana, but it is Kapha Pitta Hara in nature. So it's the ingredients, Patola, Vasha, Kadirohini, Kiratikta, Nimba, Triphala, Maleja. Kaushika Kashayam, it is telling you how to add Gugulu as a Kaushika. Kaushika means Gugulu. Gugulu as a this Anupanam, and they can use this Kashayam. After Padolamuladhi Kashayam, you can start with this Kulagadi Kashayam. The remaining Kabadosha can be eliminated by the use of this Kashayam. And Nimba Nilavagadi Kashayam is a special yoga that you can see in the Ayurveda Pharmacopoeia India, Government Ayurveda College, Trivandrum. And it has Nimba, Nilavaga, Ashwagandha, Araguda, Khadira, Dariharidra. So I told Chandra it's not this Ashwagandha. So as it contains Ashwagandha, it acts as a rasayana and it's helped to retain the skin health.